I'm Chris Distler, the physical therapist and clinic director here at the KORT Middletown Clinic. We're going through kind of a virtual open house today just to show you our new facility that we moved to. We're conveniently located at the Eastgate Shopping Center right off of Shelbyville Road. Kroger's just right over there, so easy and convenient to find. I'm going to have you follow me in and we'll go through the clinic. As you follow me this way, we're going to make our way into our lobby. As you can see, we have plenty of space for patients. So this is our front office staff. Bailey's helping us out today, helping everybody schedule, verifying insurance, and she'll be kind of the point of contact if you reach here. What we're going to go through next is head to the treatment area where most of the people are seeing. I'll come back with me this way. And we have our hand washing station on the left. And then around to the left over here, I want to kind of show off a little bit of our area to treat people after a work injury. So we see people after work injuries like most KORT clinics do here. We have a couple of special services offered at this clinic, one of which is we do pre-employment testing. So we'll see patients or candidates after they're offered a job position before they get started for work. And a couple other things we'll do is we do evaluations or assessments to make sure people are good to go back to work. So if you have a work issue or injury, we're happy to see you. And like we said, Bailey up front will be talking and work with the insurance to make that happen. One other thing that we have offered here, we'll do a kind of turn around. We have a little turf area.
Especially with as much walking stuff as you do.
So with the area of the turf, obviously this is good for patients after they've been seen after athletic injury or have been hurt on something that would need moving through the grass. What is also we found works really good for is we see a lot of people in this area who might have problems with balance or dizziness and things like that. So typically walking on some of those uneven surfaces or soft surfaces can be hard. That's another kind of avenue to help those patients get better and get them back and active on their feet. What we wanted to point out too is obviously we have plenty of area here, but we also have private treatment rooms for each of the staff to treat the therapist. So I was going to walk you over this way. We'll kind of walk through one of the rooms just to show you some of the space we have. And what we're going to show you next is some of the therapists we have.
And it was stressed. It was hurting really bad.
So each therapist has their own treatment area. So it's a nice, quiet space for you to be seen, make sure we have a good plan to get you off and going on your first appointment. And then right now we have 5 full-time therapists here, so plenty of people to help get you back and active. And what we also want to do is kind of point out some of the staff today. So I know I've introduced myself. My name's Chris. And I have introduced you to Betsy, who's working right over here. So she's going to introduce herself just briefly before we meet some of the other staff.
Hello, I'm Betsy Betts. I'm originally from Lexington, Kentucky. Graduated from the University of Kentucky back in 2016. So I've been with KORT a little over 4 years now. I am new to the Middletown Clinic, so I'm excited to be here and excited to treat all you all when you come in.
All right, and then we'll kind of turn around. We have Mark who's helping somebody out, so we're going to just have him say hi and not interrupt him working with this patient. Okay. If you don't mind, maybe just wave real quick, kind of introduce yourself.
My name is Mark, physical therapist here at KORT.
So Mark's been with us for a while now, and has moved over to the Middletown Clinic with us. And then the other staff member we have here today is Lydia. So she's helping to get somebody else set up and moving. So I'll go grab her and kind of bring her over towards us. How are you doing today?
Hi, I'm good.
Good. So this is Lydia.
Hi.
So don't you introduce yourself?
I'm Lydia Martin. I'm a physical therapist that works here, and I just joined the team recently, and it's a really great place to be. And we love this new space, so we're all just really excited to be here.
Yeah. And then we've got to show a little bit about what's happening at the clinic. What we also want to touch on today is show you how you can help yourself at home a little bit. So we know with the COVID pandemic, we have a lot of students who are doing NTI at home with their families. A lot of people are working at home too. So we're going to go over a little demonstration to show you some things you can think about as far as designing your workspace well to make sure you're not having any aches or pains with that change in the work environment. So we're going to go right down to this room here. And Betsy's agreed to be our little demo today. So if you want to grab a seat just right here, Betsy. So like most people at home, we might not have the adaptability that you would at your workspace. And what we want to talk about is some things to think about with your setup. So things that I like to think about is managing how you fit to the desk, how we can adjust kind of the keyboard or the monitor that we're using, and also adjusting the chair height. So typically, I think the thing about the desk first, you usually can't move it around a lot. So at home, that might be using your kitchen table or anything else around the house. So typically, we have to adjust how you fit your desk. So if we're using the chair Betsy's in right now, have her face towards the computer. And then obviously with the laptop, you can't kind of separate the keyboard and monitor. But a couple things to think about is when she sits, she wants her arms to fall directly to the keyboard. So that tells us that she's at a pretty good height for the space she's in. A common issue with a lot of people is the chair might be too small, or you might have a really high desk. So if that was the case, what you would do is you would adjust the desk space. So if we give an example of that, so if you lower your chair down a little bit for me if you can, I think it's on the right side. So if she were to try to do this and how her arms might have to come up, her shoulders have to come up, sometimes this could be an issue where people have some like aches or pains in their neck. And then what you would do is you would raise the chair up to make sure you get that nice space so your forearms are pretty level with the ground. So when she's here, we want to think about how she's sitting in the chair. So I bet she's doing a good job of showing what we don't want to do, so you don't want to slouch down. But what she can do to help fit it well is so she scoots all the way in the back of the chair. You want a chair that has good back support like this one here, and you should feel like your legs are supported on the chair too, but your feet are hitting the ground. So for her right now, this chair fits really, really well. What might be an issue if you have to adjust your table height is if her feet were to be up in the air a little bit when she's sitting in the chair. A good kind of tip for home is you can use like old telephone books or just something to kind of rise that ground up toward you. So we know we have a good setup for the desk and the chair. So what we're going to think about last is kind of the computer and what you'd be using at home. So for her, the keyboard's set up well. A lot of times that moves. But what we can also adjust at home is using a monitor. So if she has a monitor at this height, you can imagine if she's here a long time, her neck would kind of go forward. That could be another issue that if we kind of get stuck at the computer a lot. So if you're using a laptop, some things you could do is you could put something underneath to raise the laptop up a little bit, and that could help adjust that for you to make sure that monitor is at the right height. And then at home, if you have an adjustable monitor, that would even be easier. So if you're looking at the monitor, you would just imagine that would be almost level with your eyes, and that's a good way to make sure it fits you well. So now that we know a couple things we can do to make the monitor fit you or your setup fit you, we are going to kind of switch roles, and Betsy was going to show us. Yeah, you want to talk about posture?
Yeah, sure.
Okay, go for it.
You want me to go for it?
Yeah.
So as far as good posture when you're sitting, you want your ear fairly well in line with your shoulder. You also want to make sure, as Chris mentioned, that your neck's not going forward. So you want your chin tucked just a little bit. You want a little bit of a curvature in your low back without being too curved or without relaxing back in that chair too much, because that could lead to low back pain. And then as far as your feet on the floor, just like Chris mentioned before, to avoid putting extra strain on your leg muscles. So that's going to be the proper posture, in addition to making all those changes to your desk like he mentioned. So what we're going to talk about next is what to do if you have not had the proper setup and you have had some of those aches and pains, especially up in your neck through what we call your thoracic and your cervical region. So I'll be the therapist. Chris is going to be our patient with neck pain here. And first we're actually going to come on out into the clinic part. And I'll show you a little bit about what we did here. So Chris, if you'll have a seat for me. So for this first stretch here, we're going to be trying to work on this upper thoracic region. So what I'm going to have you do is cross your arms in front of you. Good. And then we're going to work on a little bit of thoracic flexion. So you're going to be bending forward for me. So that's one direction. And then the direction we most need to stretch in is extension. So Chris is going to come back and arch his back, keeping his eyes forward, getting a nice stretch in that upper portion. Do you mind running through that just a couple more times for us, Chris?
So going forward.
Into some flexion. And then back into some extension. If we didn't feel a huge stretch with that, we could add a towel roll or a rolled up beach towel behind the back and get a little more of a stretch into extension there. Good. For our next one, this one's going to be stretching the same area, and this one is really easy to do on the go. You don't need a towel roll or even a chair with a back or anything. So what you're going to do, Chris, is latch your hands in front of you. You're going to push your hands forward and push your mid back behind you. And what that's going to do is stretch right through this area. Good. So you'll hold that about 10-15 seconds or so. You can do about 10 to 15 of these, and that's the same for the other one as well. And then for our last one here, really stretching out the muscles in through the front, your pec muscles, that can get really tight from sitting and being forward all day. So go ahead and stand up for me, Chris. So in a door frame, what you're going to do is put your hands just below shoulder height, and then you're going to step through until you feel a really big stretch there. With this one, you'll hold it a little longer. It'll be a little more of a static stretch for about 20 to 30 seconds.
And you start through the chest, right?
Feeling it right in through these pec muscles, opening up your chest. So the more you lean in on this, the greater stretch you're going to get. So you can either do the step through or keep your feet out. Okay?
Good. So going over the setup at the desk, give you some ideas of how to arrange the home environment. And if you do have some issues at home, these are some easy things to start with to work on your own. As always, we're here if you need us. We have 3 good, convenient options right now. We're happy to see everybody in the clinic. A couple other options we have right now is we're doing tele-rehab. So that would involve us working with you one-on-one. We'd have a camera so we could see you fine and show you some of these things you can do on your own. And then lastly, we also see people in the home. So if you'd be more comfortable staying at home right now, we offer home health care, and we'll be able to see you that way too. So you can reach us by calling the clinic. You can call the KORT main number, so that's 1-800-645-KORT, so just KORT as in KORT. Or you can go to KORT.com. We're happy to get you scheduled that way. Pleasure to meet you here today. Glad you got to see the space, and we look forward to having you in the clinic.